We'll start now, right? Good evening, ladies and gentlemen. Happy Independence Day, 75th Independence Day of India. And today is a day we salute, appreciate, and applaud all the people who worked terribly hard, who toiled hard to get India its freedom some 75 years ago. It's not just by coincidence that the best series, it's indeed the best series, and best is the acronym BEST has been coined by Dr. Mamta Singh, who is one of the governing council members. Hello. Stands for Beat Epilepsy and Stay Informed. And the first webinar series, Public Awareness and Self-Management Awareness webinar series of the Indian Epilepsy Association starts on the 75th Independence Day of India. So we did in the thousands and thousands of freedom fighters who worked very hard. It's time to salute the thousands of our epilepsy warriors and fighters who have been fighting this battle against epilepsy on this particular day. And this is a year-long monthly webinar series dedicated to self-management aspects of epilepsy, dedicated to epilepsy awareness. And as you know, that the association is an association of people who have interest in epilepsy, who are great stakeholders in the field of epilepsy. On this day, I acknowledge the presence of the kind presence of our president, the past president, Professor Manmohan Mendirata, President-elect Indian Epilepsy Association, Professor Satish Chandra, the past president, some of the founder members of the Indian Epilepsy Association, Professor H.P. Srinivas, who is here with us, Dr. Praveena Shah from Mumbai, who is a past president of the Indian Epilepsy Association. We have some of the important members, the governing council members, the treasurer, Dr. Rajendra Surekha, Dr. Saras Rajendran, Dr. Carol D'Souza is from Saman in Mumbai. Dr. Ravi Naik is a governing council member, and we have the panelists. I also take great pleasure in welcoming Shri Onkar Singh Pawaji, who is the patron of the Punjab chapter of the Indian Epilepsy Association, as also Professor Sanjay Singh from Omaha, United States of America, who has kindly agreed to join us as patron of the Punjab chapter. Dr. Bhanu is there. Sorry if I'm missing out on someone. I just see that Professor Gauri Devi has just joined. Welcome, ma'am. So we have all these experts in the field of epilepsy, and the first session today is about medication adherence. It is being organized by the Punjab chapter of the Indian Epilepsy Association, with its president as Dr. Preet, who is professor of neurology at the Postgraduate Institute of Medical Education and Research, and Dr. Vinay Agar, a neurologist at Fortis Hospital in Amritsar. Can you show the introductory slides? And with this introduction, I request our president, Professor Vengamma, to kindly inaugurate this webinar series and to say a few words. Dr. Vengamma, please. Mansi, meanwhile, can you show the... Yes, thank you.
Good evening to everybody. Am I audible?
Yes.
Yes, ma'am.
Good evening to everybody, all the members of Indian Epilepsy
Yes,
Association and all the senior members of association and senior neurologists who work for the epilepsy. And I'm delighted to inaugurate the Indian Epilepsy Association, the best Beat Epilepsy, Stay Informed Epilepsy Awareness Webinar today, which happens to be the India's 75th Independence Day. And this event marks the golden jubilee year of IEA for the series of activity for the coming 1 year. I'm very happy to know that IEA is resilient and has withstood ravages of COVID-19 global pandemic. Adversity reveals the genius, it is said. The IEA quickly adapted to the changing paradigm of teaching learning methods and had been quite successful in converting the adversity of staying home or in isolation created by COVID-19 into a magnificent learning opportunity. I really thank all the governing council members for this initiative. The alacrity with which IEA had harnessed the information technology and conducting the planned regular online webinars to continue educating the stakeholders about epilepsy and its related issue is a tribute to the commitment of IEA to the cause of epilepsy control and its never give up spirit. Time passes on relentlessly. How we, the IEA, have adapted to changing times and have continued our battle with epilepsy will eventually be judged by our successors in the times to come. Quoting Sir Edward Hamley, a moth-eaten rag on a worm-eaten pole, it does not look likely to stir a man's soul. 'Tis the deeds that were done neath the moth-eaten rag when the pole was a staff and the rag was a flag. It is the deeds that we do under the IEA flag that will be remembered and will eventually become moments of history. Let us all rededicate ourselves to the cause of epilepsy control. And this first webinar is being organized by the Punjab chapter of Indian Epilepsy Association under the chairmanship of Dr. Parampreet, and they have chosen appropriate topic, that is drug adherence, which is most important for the patients with epilepsy and epilepsy caregivers. And I think from this, all of you have gone through, I think we have made a regular monthly webinars for each chapters by rotation, and everybody will actively I request participation from every member of the epilepsy chapter of each and every chapter across the country. And in this way, I really congratulate Dr. Gagandeep having taken an initiative to organize the first seminar and his team, and especially congratulate everyone who is involved in this program, seen and unseen, who have contributed to the design and conduct of this impressive academic feast. Once again, wish you all a happy Independence Day. Thank you. Dr. Gagan, you can start now, I think, program.
Yes, please. Thank you, ma'am. Thank you. And with this, without much wasting much time, can I request Dr. Parampreet to take on from here and conduct the proceedings of the session. Param?
Yeah. Thank you. Thank you, Dr. Gagandeep. Thank you, Dr. Vengama and IEA for giving us, the Punjab chapter, the opportunity to host the inaugural event. And especially Gagan for pulling me out of a bit of reclusiveness. So yeah, and I'm also happy to see all of the people Gagan introduced from IEA, IES, some of my mentors, teachers, and young friends. In addition to this, we have two patrons, as Dr. Gagandeep said. I'd like to introduce them. One is Dr. Sanjay Singh. who many of you may already know. He's accepted our request to be a patron of the Punjab chapter. He's a chief of staff at Creighton University Medical Center, USA. He's also the director of Neurological Institute at that university and a chairman and professor. He's also the past president of the Association of Indian Neurologists of America. And we had the pleasure of having him a couple of years back in PGI in this capacity. He's won many awards, including the Best Doctors Award in America and awards from the American Academy of Neurology and also the Hind Ratan Award from New Delhi in 2007. So we welcome you and thank you for being here, Dr. Sanjay Singh. We also have Shri Onkar Singh Pava, who is the chairman and managing director of the A1 Cycles in Ludhiana. He's known for his leadership potential and community engagement. He's a highly respected, socially responsive philanthropist, and we are happy to have him as our patron, and we would like to learn from your wisdom and experience. I want can I have a brief comment from Dr. Sanjay Singh?
Great. Thank you, Dr. Parampreet and Dr. Gagandeep Singh and Dr. Vineet Sehgal for inviting me to be the patron. It is always a pleasure to contribute, and it's really nice to see a lot of familiar faces and names on this grand inaugural webinar, not only for Punjab, but for India. It's a great time to be in treatment of epilepsy today. There are lots of new advances happening. I was just at an NIH epilepsy advances seminar, and we were discussing a lot of what's coming new. And so not only new medications, but treatment of epilepsy by focused ultrasounds, where you do incision-less brain surgery. And now the big push is treating epilepsy based on the genetics of each individual patient. So doing their whole genome sequencing and then tailoring the therapy to their individual genetic constitution. So it's a new day in epilepsy and a lot of new developments happening. Your topic today for the webinar is very important, of drug adherence and compliance. I still remember Joyce Kramer, who used to be in our Yale epilepsy group. She actually did the seminal study in '91 with a chip in the pill bottle to see what was the compliance of patients. And it was an eye-opening that if there was a 4 times a day medication, the compliance was less than 35%. And this is in patients who are getting free medications from the government. So it is very important to really understand this topic and to stress this for our patients and their families of how important drug compliance is. So my best wishes and good luck to everyone.
Thank you, Dr. Singh. Yes, it is. Treatment in epilepsy is making advances. We have a quick word from Mr. Pava, sir, before we go to the panel discussion.
Good evening, ladies and gentlemen. Happy Independence Day to all. It is indeed an auspicious day to begin spreading awareness about epilepsy. I commend the Indian Epilepsy Association for taking up a series of such programs nationwide. I will leave it to the experts to talk about the symptoms, the conditions, and the societal prejudice against those affected. I can only hope and pray for freedom for everyone suffering from this dreadful disease. Spreading awareness will certainly help remove the prevailing social discrimination. I wholeheartedly support the effort. It is our common cause. I wish good numbers come forward and become part of the noble campaign. Our Independence Day celebration will be a great deal more meaningful if we contribute our small bit, helping fellow sufferers gain freedom from the debility. Thank you so much, sir.
Thank you, Mr. Pava. Now I hand over to Dr. Vineet Sehgal, the Secretary of the Punjab chapter, to introduce and welcome the panelists for today, which is a mixture of experience and our and our young colleagues from the associated with the Punjab chapter. Dr. Sehgal, please.
Good evening, everyone. Happy Independence Day, one and all. I welcome you all on the behalf of Indian Epilepsy Association Punjab chapter. First of all, I'd like to thank Indian Epilepsy Association for giving us this opportunity to initiate this new, first of its kind, patient-friendly oriented webinar. So, without wasting time, today I'm going to introduce you the team of panelists. Friends, today we have a panel which consists of experienced and as well as young neurologists. So, to start with the panelists, our first panelist is Dr. Rajinder Bansal. So, can you have a slide of Dr. Rajinder Bansal? So, Dr. Rajinder Bansal is well-renowned personality and he is a professor of neurology currently at DMC Hospital, Ludhiana. He has more than 20 publications in peer-reviewed journals and he has more than 25 years of experience in the field of neurology. So friends, today we are going to gain from his experience. Our next participant is Dr. Vineet Jason. He is currently Associate Professor, Christian Medical College and Hospital, Ludhiana. His primary area of interest are epilepsy and neuromuscular disorders, and he has received the Young Neurologist Award in World Stroke Congress in Istanbul 2014. Next, please. Dr. Sudhir. Our next participant is Dr. Sudhir Sharma. He is currently Professor and Head Department of Neurology, IGMC Shimla. His area of interest are stroke and epilepsy. Sudhir is known for starting telestroke project in the state of Himachal Pradesh, and that he has also received State Innovation Award in 2015-16. Next, please. So our next participant is Dr. Jitubam Besha. He has done his DM Neurology and PDF Electroencephalography from Shri Chaitanya Institute, Trivandrum. He is currently Assistant Professor in Department of Neurology, PGI, Chandigarh, and he has a special inclination towards epilepsy. Next, please. Then finally, we have a final participant, young and dynamic Dr. Jaslavin Kaur Sidhu. She is currently Assistant Consultant, Department of Neurology, Paras Hospital, Panchkula. She is specially as an inclination towards the movement disorders and epilepsy, and she did her DM thesis in epilepsy also. So, friends, we're looking forward for an informative discussion from all of you on this very vital topic. Dr. Param.
Thank you, Dr. Vineet. So we go on to the panel discussion. I request all the seniors experts present here as we've introduced and our teacher, I can see Dr. Prabhakar also here, sir, and Dr. Gauri Devi. So all of you, please contribute to the discussion and give us inputs on based on this important topic. So going to the topic, as said, it's a very important topic because adherence to anti-epileptic drugs is a little different from adherence to other medications. For a simple reason that in other diseases, if like blood pressure or diabetes, if you don't take drugs, you start having symptoms, you may have some other things. But epilepsy is the only medication where people may have 1 or 2 episodes in their entire life and may have to take medications for many years. This ends up confusing the patients, and sometimes they end up missing their medications. So, and there's according to studies, about 70 to 80% of patients occasionally miss their medications, and some people even stop it. So today in our question answer session, we want to gain knowledge and impart it and give information to our patients and their carers regarding how to circumvent this problem. To these patients, it will be a general discussion. So you may want more specific guidance regarding the issues from your regular doctor. This will be not to a specific patient, but general points. So to all the panelists and everyone, let's start with that. Could somebody start listing the consequences of non-adherence? Why do we consider adherence an important issue? What would the patient expect if we don't adhere? So anyone? Yeah.
So thank you, Dr. Param, for asking this question. I think this is one of the most important questions, unless until people with epilepsy are aware about the consequences, so the importance of adherence cannot be signified. The consequences, as people with epilepsy should be aware, is number one, repeated attacks of epilepsy. They increase admissions, they increase cost of care, emergencies. Another important thing is it leads to accidents. You see many times that you come across freak accidents, and in many studies, people have seen that drug levels of anti-epileptic drugs were low in these patients. Important consequence which people should be aware is that SUDEP, sudden unexpected death in epilepsy patients, where you don't find any cause. This is more common in people who have uncontrolled epilepsies. So I think these are the important points which people with epilepsy should be aware about.
Yeah. Thank you, Dr. Bansal. Anyone wants to add to that?
Param, I just wanted to know whether this program is for doctors or for patients and caregivers.
So it's we are all part of it basically, and it is aimed at giving information to their patients and caregivers mainly. But since all of us keep getting asked these questions by our patients, many of our young colleagues may benefit from this knowledge that how to answer these questions to our patients and their caregivers also. So this is a problem we all face.
So this is only meant for doctors now.
No, so there are a lot of patient attendees here today. There is patients and their caregivers attending from all over the country.
So we request
almost 80 to 90% are doctor. That's why the question.
Yeah, sir. There's many times the other participants are not visible. The non-panelist people are not visible on this list. Yeah.
Okay.
So one thing, sir, I need to request the audience to actually, they can write down their queries in the question answer box. So we have slides for that. Important message for all the participants. So they can write down their queries in the question answer box. And we will try to give each and every answer after the end of the session. And if any question is left unanswered due to time constraint, then we will write them on the mail. So they can also drop their email address along with the question.
Yeah, thanks, Vineet, for telling that. So, yeah.
May I answer? Yes.
Yeah, please.
I wanted to say that what has been said already, if you tell the patient that if you miss the medicine and you get attacked, the treatment duration will be much more. And if you keep doing it, then probably you have to take the treatment lifelong. So that is one message which may keep the patient adherent, may keep compliant. Second issue is to look into what are the reasons for non-compliance. Often in the peripheries, a boy or a girl who is dependent upon the supply to be brought by father, he'll say, sir, medicine was over and it could not be procured. So it is always requested every patient to procure the medicine when the few days medicine is left. It is not going to expire. It is not going to be rotten like vegetables also. So you should have adequate stocks. And I've seen few patients who they said that they, because of Corona lockdown, they could not procure it. It may be a genuine one because there were a lot of restriction on things. Second issue is that which is to be emphasized again, that many ladies may keep fasting. There's a Karwa Chauth fasting, there's other reasons for fasting, and they may do it without even water. So it is, I tell all my patients that no religious books ever mentions that even if you are fasting, you should not take medicine. So this is important to emphasize that you take food or do not take it, medicine has to be taken very regularly.
Thank you, Dr.
Third is one point that often it is sort of a carelessness. You take medicines after dinner and then your dinner was over, then there was a phone call, there was some relative came visiting, or some reason you slept. And then that way you forget genuinely, there was no intention not to take medicine. So for last many years, I suggest to all my patients, I don't know, it is not mentioned anywhere, that if it is a twice a day medication, which majority of time patient is on, I tell them to take morning, like suppose you take breakfast at 9, you take medicine and then take breakfast, you take medicine and then take dinner. So dinner may be delayed, but the medicine maybe should be taken at the right time. You can keep it in a plastic box and then you can have it very regularly. And if you take it before breakfast, before dinner, as you are not going to miss your breakfast, you are not going to miss your dinner, then that way probably you will remember always to take medicine. I myself do it for, thank you.
Thank you, Dr. Agarwal, for very important points. So as everybody can see, there's a lot of effects of not adhering to anti-epileptic drugs, but still sometimes we might miss, and that is what we're going to discuss in the further questions. Another thing which Dr. Bansal mentioned about SUDEP, for people who don't know, SUDEP stands for sudden unexpected death in epilepsy. Now, we don't need to be unnecessarily afraid of this, because it's a very uncommon happening, 1 in 1,000 people. But it is a fact that I think we all should know, and sometimes we discuss with our doctors, and to know that what are the risk factors so we can avoid them. So the risk factors are uncontrolled epilepsy and generalized tonic-clonic seizures, along with missing the medication. Sometimes lower doses have been found in these people. So once we know that, thankfully, and taking a lot of alcohol is also a risk factor. So if we can avoid them, although it is an uncommon condition, knowing it in people who have uncontrolled seizure is a good thing for everyone. So the next question I would like to ask Dr. Yes, sir. Yes.
Yeah. गुड इवनिंग, शुभ सायंकाल सबको। दो लोगों ने पूछा कि क्या आप हिंदी में नहीं बोलोगे, खालसा साहब ने और लुटी साहब ने। तो मैं हिंदी और इंग्लिश दोनों में मिक्स बोलूंगा, क्योंकि बहुत सारे पेशेंट हैं। मैं पेशेंट नहीं कहना चाहूंगा, पर्सन विद एपिलेप्सी। हम आपके लिए वर्ड जो है पेशेंट विद एपिलेप्सी नहीं यूज करते, ये इंटरनेशनल ब्यूरो ऑफ एपिलेप्सी की डायरेक्शन है। हमें वर्ड यूज करना है पर्सन विद एपिलेप्सी और पीपल विद एपिलेप्सी। अब आज है दवाई रेगुलर लेनी है, नियमित रूप से लेनी है, या बीच में आप छोड़ सकते हैं। कुछ दवाइयां जो दिन में एक ही बार लेनी है, वो रात को एक बार ले सकते हैं, जैसे डॉक्टर अतुल ने भी बताया। कुछ दवाइयां दिन में दो बार लेनी है। अभी ऐसी कोई दवाई नहीं बनी जो एक वीक में एक बार ले पाए या एक महीने में एक बार ले पाए। जैसे अभी इंसुलिन आ गई है, एक वीक में एक इंजेक्शन, पर अभी जो एपिलेप्सी की दवाइयां हैं वो रोज लेनी है नियमित रूप से। हम अक्सर कहते हैं कि ये जो पर्सन विद एपिलेप्सी उनका फॉल्ट है। नो, मेनी टाइम्स फॉल्ट डॉक्टर्स का भी है, हमारा भी है, मैं अपना कहूँगा। वो किसकी है कि हम लिखते हैं ये दवाई एक महीना, बहुत बिजी है, ठीक है। पेशेंट सोचता है एक महीने के लिए लेनी है, डॉक्टर साहब ने बताया। बहुत सारे पेशेंट वापस आते हैं, डॉक्टर साहब आपने कहा था एक महीने, हमने बंद कर दी। तो ये हमारी भी ड्यूटी बनती है, रिस्पॉन्सिबिलिटी है कि हम पेशेंट को एक्सप्लेन करें कि आपने जो दवाई है ये 2-3 साल चलेगी। शुरू में इमोशंस में बहुत सारे पेशेंट कह देते हैं सर जितनी मर्जी महंगी दवाई लिखो हम लेंगे, पर 3-4 महीने बाद एग्जॉशन आना शुरू हो जाता है। जो फाइनेंशियल एग्जॉशन हो सकता है, दवाई लेने का हो सकता है, या वो अपनी डेली लाइफ उनकी इंटरफियर हो रही है तो उसलिए नहीं लेना चाहते, या कुछ साइड इफेक्ट होते हैं। तो इसके लिए शुरू से ही हर एपिलेप्सी के पर्सन को डॉक्टर के साथ एटलीस्ट, और डॉक्टर को पर्सन के साथ और पीपल विद एपिलेप्सी के साथ 10 से 15 मिनट काउंसलिंग बहुत जरूरी है। और ये हमारा भी फर्ज बनता है कि हम क्लियरली एक्सप्लेन करें कि आपको ये दवाई रेगुलर लेनी होगी। अभी मैं 1 महीना जो लिख रहा हूँ, आपको 1 महीने के बाद आना है दोबारा दिखाने, ना कि दवाई 1 महीने तक। थैंक यू फॉर।
Thank you, sir.
Can I speak?
Yeah, please.
Yeah, the way I explain to the patient is, of course, we all know that compliance is poor in all chronic diseases, including hypertension, diabetes. So I tell them, if you miss a tablet for a day for diabetes or BP, you may not realize the consequences. But when you miss an anti-epileptic drug, you are likely to get a seizure. The duration of treatment varies from 2 to 5 years, depending upon the type of epilepsy. And if you miss a tablet and get a seizure, it will be another 2 to 5 years. Many times when we say the treatment is for 2 to 5 years, they think from the time of prescription. So I'll have to emphasize that the moment you leave a medicine and if you get a seizure, again another 2 to 5 years, again you take for 6 months, somebody promises we'll cure in 6 months, you stop it, you may not get an attack for another 10 days, then you get a seizure, again 2 to 5 years. So people like you who are very irregular give a bad name to epilepsy. Arey, epilepsy to kya hai? Wo to lifelong ka treatment hai. So people are giving a bad name to epilepsy, but epilepsy is not bad. The second point I tell is especially for lady patients. I said, whenever you fight with your husband, miss a meal, but don't miss the tablet. Because if you miss the tablet out of anger, you get a seizure and then maybe your husband will be affected. But you get a seizure and again there is a postponement of the number of years you are going to take. The third point I tell them is tablets ho gaya saab, next day band tha. They said, will you not keep a stock of sugar, coffee, rice, everything? So keep 1 month stock on the table and 1 month stock in the cupboard. So whenever 1 month stock on the table is gone, bring it from the cupboard and you have another month time to purchase it. I think these are all very important practical points to stress upon them. The most important point is the treatment period is from the last seizure. Now that I think is a very important point to stress upon.
True, sir. True. That is true. Thank you, Dr. Srinivas. So coming to Dr. Sudhir Sharma. Yes, ma'am. Sorry, I didn't hear you. Dr. Praveena, please. Yeah.
No, I endorse what Dr. Mehndi said, that we have to explain right in the beginning, but I also write on the prescription when I give. Usually we give medicines for maybe say 2 months, 3 months maximum from chemist point of view, but I always write not to stop or change the dosage till further advice. Right. And I write follow-up after 3 months. I think even writing on prescription is very important. That's number one. And number two, very often whatever trade name we write may not be available in some rural areas. So I think it's better to write always a generic name and maybe even another option, 1 or 2 other trade names, so that if one is not available in a rural area, at least the next one is available for them and they don't miss a single day. Thank you.
Right, ma'am. Thank you so much. These are very important points. I will reinforce them maybe later in Hindi. Coming to one of our panelists, Dr. Sudhir Sharma. Dr. Sudhir, one of the important questions which we face, we collected some questions from patients and everybody's patient is that if I miss one dose, what should I do? Agar mere ko miss ho gayi, I have not had a seizure. एक dose miss हो गई है, what should I do in that scenario? When should I take the next dose? So it's something which I get asked very commonly. Would you want to answer that?
Sir, it is a very pertinent question because I find most of the time this question is left unaddressed at the time of starting anti-epileptic therapy, whereas that is the right time when it should have been addressed, and more so because these drugs have to be taken for such a long time. And then the frequency may vary from once a day dose to 4 times a day. And then some patients may be on 2, 3, or even 4 drugs. So there's a high chance of missing a dose of the drug. And in fact, up to 80% patients, they occasionally miss a dose. And missing a dose is the most common cause of breakthrough seizures, that is recurrence of seizure in a person who is already on anti-epileptic drugs. And sometimes these seizures can be very severe or prolonged, what we call as status epilepticus. So it is very important to know for the patient what to do when they miss a dose. Now, ideally, because anti-epileptic drugs, they have different mechanism of action, different duration of action and other properties. At the onset of starting anti-epileptic therapy, the the physician should explain to the patient that what should be done in the case that patient misses the drug, depending on the drug that patient is taking. But as a general recommendation, if a person with epilepsy is taking anti-epileptic drug once in a day, that is once in 24 hours, then if he remembers that he has not taken the drug within first 12 hours, then he should take it immediately. But after 12 hours, that is when the time for the next dose is less than 12 hours, then he should let that dose be missed and take the next dose as usual. In case of a drug which the person is taking twice daily, that is 12 hourly, if he remembers within first 4 hours, he should take the drug as soon as he remembers. But after that, he should let that dose be missed and then take the next dose as usual. But he should avoid taking double the dose at any time, because it can cause side effects and toxicities. And to explain it in Hindi once again, अगर आपकी जो मिर्गी की खुराक है वो आप दिन में एक बार ले रहे हैं, तो यदि आप उसे लेना भूल जाते हैं, तो अगर 12 घंटे के अंदर आपको कभी भी याद आ जाता है कि मुझे वो खुराक भूल गई, आप उसे तुरंत ले लें। परंतु 12 घंटे के बाद जब आपका जो अगली खुराक का समय है उसका समय 12 घंटे से भी कम है, तो आप उस खुराक को आप छोड़ दें और अगली खुराक अपने नियत समय पर लें। उसी प्रकार यदि आप कोई ऐसी दवाई ले रहे हैं जो 12 घंटे में दिन में 2 बार ले रहे हैं, तो आपको यदि 4 घंटे के भीतर याद आ जाता है कि मुझसे वो दवाई भूल गई है, तो उसे तुरंत ले लें। परंतु उसके बाद आप उस दवाई को मत ले, उस डोज को जिसे आप भूल गए हैं, और अगला डोज जो है वो नियत समय पर लें। कभी भी अपनी जो खुराक है वो दुगनी ना लें इस भ्रम में कि हमारी एक गोली छूट गई तो हम 2 इकट्ठी ले लेंगे, क्योंकि उससे कई बार नुकसान भी हो सकता है।
Thank you, Sudhir. Thank you. Yeah, it's a important question you've answered. So it basically depends upon the type of medication. You should be talking to your doctor because every medicine different. As Dr. Sudhir said, long-acting medicines may not be taken. Again, short-acting medicine can be taken early and ज़्यादा कम गैप डाल के पूरा कर सकते हैं। तो ये डिफर करता है हर दवाई के हिसाब से, उसकी जो कितना देर एक्ट करती है उसके हिसाब से उसकी टॉक्सिसिटी प्रोफाइल कितना वो तंग कर सकती है अगर हम डबल डोज ले लें। सो ये चीज जब आप अपने डॉक्टर से बात करेंगे तो उससे एग्जैक्टली पूछ सकते हैं कि ये वाली दवाई अगर मिस हो जाए तो उसके लिए क्या करना चाहिए। थैंक यू सुधीर फॉर दैट। Dr. Gauri Dev.
Like to make a comment. One of the common things which we find is those people who have relatively infrequent seizures, let us say once in 2 months, they say, fit nahi aaya, no seizure, so let me stop. I think that is very important. We should tell the patient, even if you don't get seizures for some time, do not stop unless the doctor advises. So I think all of us have faced that situation.
Absolutely.
And, yeah. Another thing is, I have seen not that common, but sometimes when the seizure issue of the girl to be married is hidden from the future bridegroom or the in-laws, what happens is these medicines are taken in a very secretive way. So I had some patients in Delhi where the mother will come, put the tablets, anti-epileptic drugs, in a vitamin B complex or in some container which has outside as B complex and gives it to the daughter. Once in a way when the supply finishes and suddenly the fits occur. So I think this has been brought out also when we deal with women with epilepsy. I think Sanjeev Thomas and others have mentioned. Yes, I think it's better to reveal rather than hide this information. How long this girl will hide that, you know? She has to take it secretively. The supply has to be given by somebody. I'm sure all of us have faced this situation. So I think at some stage, we have to do the counseling for the
True, ma'am. It's one of the commonest dilemmas patients feel, especially the women patient, unfortunately. Thank you, ma'am.
Yeah, Param, one important aspect that,
Dr. Mishra, please.
Yeah, is the recent times, the people who take COVID vaccine, you know, the people who gives the vaccine ask them to stop all the medicines. Really? We have seen that the people taking vaccine, they stop medicine, they get seizures. So I think even if you take vaccines, And especially in this region, I have, allowed the divisional commissioner to take out a notice that all the people who are on neurological problems should take regular medicine even after vaccine. But I think we have to emphasize to the patient that even if you take vaccine, you should take vaccine and don't stop the medicine. Continue this medicine as well as other medicines. Thank you.
Right.
Sometimes there is a question that I am not sure whether I have taken the medicine or not. So should I take one more? So my answer is missing a dose is more damaging than one extra tablet, which is not going to cause any toxic effect. So whenever you are not sure, please do take another tablet. And then second thing I emphasize is morning you should take between 8 and 9, night between 8 and 10, because the drug action is 12 hours. Whether you have breakfast or lunch or dinner or no dinner, nothing, tablet must be taken during that hour, 8 to 9 and night 8 to 10. Because the concept in public is any tablet you prescribe, khane ke baad lena hai. So which then Sunday the wife gives the breakfast at 12 or 1, then they think the breakfast nahi khaya, isliye my tablet nahi liya. So timing is important. It doesn't matter whether you have food or not.
True, sir. Thank you, Dr. Srinivas. Dr. Jason, I come to you. Many times we have patients very confused how long to take the medicine. So we have patients who come to us, so 3 साल के बाद बंद करके आ जाते हैं दवाई. We ask them why, and they say that it is a 3-year course everywhere. My cousin took it, my friend took it. It's a 3-year course. So how do you want to address this to the patient sitting here? That is it a fixed course for everyone, or does it differ, Dr. Jason?
Thank you, Dr. Param. I think that's a very important question. And I also believe in empowering the patient with their own decision making. So every epilepsy is different. I think हम जानते हैं जो epilepsy है बहुत एक विभिन्न प्रकार की बीमारी है. हर एक मरीज अलग होता है, उनकी बीमारी अलग होती है. So to simplify the whole understanding of epilepsy, there are 3 things that we always look at. One is the underlying neurological condition that has caused the seizure. Second, we look at the EEG of the patient, and we look at how many seizures the patient has had. 3 चीजें हैं. एक तो हम देखते हैं कि कौन सी बीमारी के कारण मरीज को मिर्गी का अटैक पड़ा. दूसरा है कि उसको जो EEG में क्या क्या चेंजेस हैं जो हम सब ने करवाया होगा कभी EEG अपना. और जो तीसरी बात है कि कितनी बारी हमको ऐसे दौरे के अटैक पड़े. जब इन सब चीजों को हम ध्यान से देखते हैं, when we look at all of these, we realize that if a patient has had only 1 seizure and his MRI is clean, he doesn't have underlying neurological condition that's going to cause a recurrence of seizure, and if the patient has EEG is also normal, he's at a very low risk of having another seizure. So if he has very low risk of having another seizure, he does not need to be continuing his anti-epileptic medication or even starting, especially if he's had only 1 seizure. The other thing is, if the patient has an underlying neurological condition which can cause recurrence of seizures, or the patient has had more than 1 seizure, has had 2 seizures, and his EEG is also abnormal, this patient has had very high risk of having recurrent seizures. So he needs to be on his anti-epileptic medications. Now, when the patient has received anti-epileptic medications after 2 years of being on anti-epileptic medications and has had no seizures, 2 साल अगर दवाई खाने के बाद उनको दौरा नहीं पड़ा, so then we can consider coming off these medications. Even at that point, it's very important to individualize in each patient. If the underlying neurological condition has recovered, if the patient is at very low risk now of recurrence of seizures, then we can optimize. उस समय हम देख सकते हैं कि दवाई कम करने पे कितना खतरा है दौरा पड़ने की.
Right, Vineet. Thank you. Yeah. So you understand, it's very important point जो Dr. Vineet ने बताया है कि epilepsy हर एक के लिए same नहीं. It is not the same disease for everybody. Epilepsy for a certain patient may be only one thing. For people dealing with epilepsy like experts, epilepsy is of many types. So every epilepsy disorder has its own set of treatment. There are some seizures जिनके लिए हमें सिर्फ 3 हफ्ते या 6 हफ्ते देनी पड़ती है दवाई, acute seizures. और जैसे कोई cyst है उसके लिए 6 महीने से साल देना होता है. Then the usual 2-year, 3-year were a rule. And many epilepsies, not many, but some of them require decades-long treatment. So it is important to understand that you need to discuss it with the doctor that my kind of seizure and epilepsy requires how long a treatment. It is not the same. Shoe will not fit everybody. And depending upon your story, depending upon the medication, the history and the type of epilepsy, the treatment may vary a lot from patient to patient. So do not hear what the neighbor says that it is 2 years or 3 years. Go and discuss with your doctor. Thank you, Dr. Jason, for that comment.
Can I come in?
Yes, sir, Dr. Satish Chandra. Yeah.
Just wanted to add one more sentence to what you said, that when you say epilepsy treatment, it is not uniform, as you mentioned. There are patients who always believe only the generalized seizures are epilepsy. These smaller attacks, or what we call as an abortive seizure or a minor seizure, are not considered as epilepsy among the general public or people living with epilepsy or the carers. So it has to be strengthened that every small epilepsy also need to be treated. So before stopping or before considering reducing the drug, one need to be aware of these smaller attacks also. Please, whenever a patient goes to a doctor, note down these smaller attacks and tell them whether they had a minor attack or no attacks during the period. Then on the basis of that, the doctor will decide whether treatment has to be continued or tapered or stopped, and leave that to the doctor. So it is extremely important to note this point.
Can I add something? Can I add a point to that?
Yeah, Dr. Banu, please.
Sometimes when they're not sure, I tell them that there is a camera in your cell phone itself. Do the video of whatever is happening and then send it across to me. So even last week, I saw one lady who was just unaware. She kept on adjusting her sari. That was only her attack. She doesn't respond at that time. They are not convinced that this is a seizure. So I said, you have to do the video and show it to me. Then I will explain to you. Nowadays, with the cell phone, it becomes easier to note other seizures. And also to maintain a seizure diary in the phone, whether it's a major attack or minor attack or they're not sure. So and there are also seizure alerts which can be of use.
Absolutely, absolutely. Thank you, Dr. Banu. So for the patients, with Dr. Banu and Professor Satish Chandra just said was कि सिर्फ जो झटके वाला दौरा big seizure वो नहीं है. अगर आप अपने डॉक्टर से बात करेंगे, छोटे छोटे दौरे जिसमें कि सिर्फ 2 सेकंड के लिए गुम होना है, and if you just are unconscious or disconnected for 5 seconds, that can also be a seizure. So when you go to your doctor, tell them everything. Do not talk about only big seizures, because the small seizures may also need treatment. Thank you very much. I go to Dr. Jeetu Baishya now. Dr. Baishya, I mean, we are discussing adherence, but nobody really wants to have seizure. No patient wants to have seizures, and कोई भी मरीज नहीं चाहता कि उसको दौरे हों. So I want you to give some points on what makes people miss medication. What are the common things which make people miss medication? Dr. Baishya.
Yes, the causes of non-adherence are very important, and I mean, it varies among different group of patients. So unless we address each of these causes individually to the patient, then it becomes difficult to maintain compliance. Some of the causes are already discussed by previous speakers. However, I feel most common answer what we get when we ask why you missed, आपने दवाई क्यों miss किया? First, most common answer we get is forgetfulness or drug was not available. So apart from that, also, if we see, I mean, the causes of non-adherence can be either because of disease or therapy per se, or it can be because of psychosocial and demographic causes. Among disease, as Sanjay Singh sir has already mentioned, if patient is on multiple medication, then it is very frequently patient misses drugs, and it is a common factor. So whenever we are seeing patient, we should try to reduce the number of doses. That will actually improve compliance. Another is when patient is on polypharmacy, multiple medications, adverse effects are multiple, that will lead to non-compliance. Third factor is if despite on multiple medicine, patient continue to have seizure, people with epilepsy become frustrated and they tend to miss medicine. Opposite situations are also seen. Suppose a patient is seizure free for many years. So they feel that there is no need of taking medicines, and missing a dose of medicine or multiple doses becomes common. Apart from this, what I feel for us, psychosocial and demographic factors are very important in our society because a lot of, as Gauri Devi ma'am has already mentioned, marital issues and gender disparity is, very common in people with epilepsy, and a lot of patients, every one of us face such kind of situation. Before marriage, patient was well controlled with anti-seizure medicine. After marriage, they come back with breakthrough seizures because the patient was having seizure was not disclosed to in-laws, and after getting married, the medication was not regular. Similarly, lack of social support, whatever, and education, occupation. Lastly, many people, they believe that there is no need of medication, low medication necessity belief, which is mainly seen in patients who are well controlled in medicines. In those patients also, rate of compliance or adherence is less. And lastly, one of the most important factors is lack of proper communication between us doctors and people with epilepsy. It commonly happens when we switch one anti-seizure medicine with another. We gradually increase the dose of one anti-seizure medication, simultaneously come down, gradually taper other medication. That time, even if we explain the prescription to patient, I feel many of them doesn't understand it properly, and missing a medicine and a discontinuation is very common. Secondly, as Mahendra sir has already mentioned, we ask the patient to follow up after 3 months or 6 months, but they think that we can stop the medicine at 3 months or 6 months, and they may follow up after 2 weeks or 3 weeks after the exact time of follow up. So I think these are the causes which we commonly face.
Absolutely.
Patient with non-adherent.
Yeah, that's very pertinent, Dr. Vaishya. What Dr. Jitu is saying is basically, instead of getting into that there's somebody's fault and the doctor blaming the patient and the patient getting confused, it's a very important to have a clear communication about the effects, side effects, the duration of treatment. Most of the time is just a communication gap between the doctor and the patient. And for patients, you should ask all these questions to your doctors if you have any doubt in your mind, whether you can stop treatment, whether this medicine is benefiting you. Before taking a call yourself, it is always good to go and ask the doctor that whether this can be changed. I have an issue with this. So this all needs to be done before we change. Many times what happens is people change and stop and then go and talk to the doctor, and they have had patients before. So what I gather from Dr. Vaishya's thing is that clear communication, and whatever is your problem, whether if it's an expensive medicine, ask your doctor if there are cheaper alternative available, and whatever the issue, before stopping yourself, ask any of these questions to your doctors, and that will help us not getting breakthrough seizures. Thank you, Dr. Vaishya.
I just have a small point which I recalled, Parampreet, if you permit.
Yeah, ma'am.
You see, nowadays doing yoga and pranayama is excellent. But I have few patients of epilepsy who are well controlled. They started doing Kapalbhati, which is really a hyperventilation. I'm sure many of you also do it. So nowadays I write, avoid Kapalbhati. You can do Anlom Vilom, but not this. I think that's very important. Well-controlled patient of epilepsy for a year or so started this with great enthusiasm and had the attack. That means anti-epileptic drugs for another 2-3 years. So I take this precaution. I don't know if you have also observed such phenomena.
Right, ma'am. Absolutely. Thank you, ma'am. So Dr. Bansal, Dr. Rajinder Bansal, I come back to you. Dr. Jitu has mentioned these reasons and some of the tips which we can do to not make patient miss medication, improve adherence. Do you have anything to add to that, what we can do to avoid missing medication?
Yes, Dr. Param, thank you. I think most of the things have been covered by experts, Dr. Mandiratta, Dr. Srinivas, Ma'am Gauri Devi, Dr. Satish Chandra, Dr. Meshram, and Dr. Latur Agarwal. But in this webinar, we have experts like them. We have primary care physicians, we have people with epilepsy, we have their family members. So just to put at one place, I will just reiterate these points in next 2-3 minutes. So one of the points which Dr. Jitu raised was lack of communication, and Dr. Param also. The first meeting is the most important meeting point. Many times all of us come across a patient के जी हमने दवाई छोड़ दी थी, क्यों छोड़ दी थी? डॉक्टर साहब हमें लगता नहीं है कि हमारे मरीज को मिर्गी का दौरा पड़ता है, जैसे मैम ने बताया बड़ा दौरा छोटा दौरा। तो फर्स्ट मीटिंग शुड reiterate that you have the diagnosis of epilepsy, whether it is a major epileptic attack, minor epileptic attack, and if you have any issues, you have any doubts, please clear at this moment now. So that is the first point. Person with epilepsy and family should be clear about the diagnosis. Second point is about the duration of that. Sometimes person has just 1 or 2 seizures, and after 1 or 2 years, they start thinking that we don't need these medicines now, as ma'am raised this point very effectively. So we need to tell them whether it is 1 seizure prior to start of the treatment or you have 10 seizures, the treatment duration does not change much. Dr. Sanjay Singh told us very nicely the number of drugs. He quoted that if somebody is taking a drug 4 times a day, the compliance goes down to less than 35%. So all of us should make it a point that the regimen should be once or twice in a day. The cost of drugs is very important. Now you have newer anti-epileptic drugs where a drug costs 20 rupees a tablet, which comes out to be about 1200, 1400 rupees a month. So we should discuss with the family that this is the cost of the drug per month and you need to take it for few years. So it is not good that you change this on your own after 2, 3, 4 months because of unaffordability. So the cost should be discussed with the family. And importance of adherence, as I already said, that these are the complications. If you start missing, that needs to be told. One important point is that common side effect of the drug should be told to the person with epilepsy and their family members. Yes, many times people come back after 3, 4 months. जी हमने दवा छोड़ दी है, क्यों छोड़ दी है? डॉक्टर साहब चक्कर आने लगे थे, इनको कभी कभी 2 दिखाई देने लगे थे, बच्चा है स्कूल जाता था, वहां पे टीचर कहता था ये क्लास में। So I think we should tell them about the common side effects and how to manage them. Sometimes young girls, they start gaining weight and they stop this medicine. I mean, sometimes they complain that we started hair fall and so we stopped this medicine. So the common side effect must be told to the family. And
again, carry on. So I was.
Availability of the drugs is another important issue. Dr. Gagandeep did a very nice study. I think we will have his comments after this panel discussion. In Ludhiana, means anti-epileptic drugs were available only on 10 out of the 47 drug stores visited by our healthcare workers to see the availability of the drugs. So we must ensure and tell the patient that this drug may not be available with your next door drug store. So please go to the main hospital, there you will get these drugs. Sometimes pharmacist has a very important role to play. Sometimes they say, like in clobazam, they say, this is a banned drug, this is not available, so family stops that drug. It is not available without prescription, so something to do with the side effects of the drug. And this is the role of the healthcare providers.
Sorry, Param. I'm interrupting. Actually, I'm not going to give any comment today. I'm just the timekeeper. So I just want to remind you that we are running a little beyond time.
Yeah.
So, Param, you need to move ahead.
Yeah, all right. Now, thank you, Dr. Bansal. They were all very, very important comments. I think we had just one more thing in mind. Maybe Dr. Jasserleen can answer that. A common question among patients is that should I be taking these long release preparations and about immediate release preparations? What are the benefits and what are the cautions they have to take if they're taking long release preparations?
Thank you for asking such questions, sir. I would also like to comment on what Dr. Bansal just mentioned, that we should always be telling the patients to take the medication in a good amount, like, because all these medications are not available at all the shops, like sir just mentioned, and he's going to detail us about the study at DMC. So yes, there are 2 kinds of medications in epilepsy, short release and the long acting ones. I would tell my patients that, as mentioned by your doctor, as per your seizures, whatever is prescribed, please follow that. Many patients also ask another question, that if the same brand is not available, or can we take another brand? I think, like ma'am also previously mentioned, that avoid writing the brands. We should be writing more of drug names, but if particular brand has been written, and that is not being available, we can always tell the patients to either contact us through telemedicine, which is so easily available these days, and also try to take the similar brand, because all the pharmacists are not very clearly educated about the brands or changing the drugs. So taking SR long-acting preparations or short-acting or even changing the brand should be done after discussing with your doctor. It's very important that you take whatever is written in your prescription.
True. Absolutely right, Dr. Jasoline. So in short, we need to,
Can
if
I make
possible,
30 second comment, 30 seconds?
Yes, sir.
यहाँ बहुत पर्सन विद एपिलेप्सी हैं और केयर गिवर्स हैं। मेरी सबसे रिक्वेस्ट है, तो हम सबसे बड़ी प्रॉब्लम फेस करते हैं कि हमें पड़ोसी ने कहा, हमारे रिश्तेदार ने कहा, हमारे दूसरे पेशेंट ने कहा दवाई नुकसान देगी, ये मत लो। तो मैं उनको हमेशा कहता हूँ, in India everybody is a doctor except the doctors, so please follow doctor's advice and ask them in detail. अगर आपने बंद भी करना है तो डॉक्टर से पूछ के करिए। डॉक्टर जिसने इतना पढ़ाई किया है, इतना मेहनत किया है, तो उसको आप इग्नोर नहीं करिए, और जो इधर उधर की राय होती है उसको एक्सेप्ट ना करें डॉक्टर की राय के बिना। थैंक यू सो मच।
Thank you, sir. Going to the next, Dr. Sanjay Singh, you've seen a lot of these cultural issues are related to that. Before we go to our next segment, would you say something from the perspective of your setup or anything different?
Yes, I mean, I think medication adherence is the key to management in epilepsy, because, we can have all kinds of advanced treatments, but if the patient doesn't adhere to it, that is not good. So it is important to stress that amongst patients, and patient education and education of the family is really important in these matters. So, as I see a lot of requests to speak in Hindi too, आपको for the patients and their family members, आपको दवाई नियम अनुसार लेनी है मिर्गी की, क्योंकि अगर आपने दवाई बंद की बिना डॉक्टर से बात किए हुए तो आपको मिर्गी का दौरा पड़ेगा। तो इस बात को ध्यान में रखना है। अगर कोई साइड इफेक्ट हो रहे हैं तो आप अपने डॉक्टर से बात कर लें कि इसको दवाई बदल सकते हैं या दवाई की डोज बदल सकते हैं। दूसरी चीज ये भी है कि आपको दवाई अलग अलग मिर्गी की अलग अलग दवाई होती है, तो जैसी दवाई बताई जाए वैसी लें। जैसे डॉक्टर मेहदी रत्ता ने कहा कि कोई बता दे कि मुझे इस दवाई से फायदा हुआ और आप गलत दवाई पे हैं, वो चीज ठीक नहीं है। आपके जो चिकित्सक हैं वो जो आपको दवाई बता रहे हैं उसको नियम अनुसार आपको लेना है, तो उस पे ध्यान दें। And I think for the physician part, the things that we do here, technology helps a lot. Now, a lot of people have smartphones. Set up an alarm if you have to take it twice a day. If you brush your teeth twice a day, we tell them a strategy of keeping it, right next to your toothbrush, so that something that they can really, remember to take the drug. It's a very common problem. And the best strategy that we have found at our epilepsy center is that on their smartphones, they set up this alarm, right? And so they'll have to switch it off if they're going to take the drug, and that helps them quite a bit. So simple strategies can really be critical in the management of such patients.
Thank you, Dr. Singh. Thank you. We're running short of time. So before I take on Preeti Singh, our author, for the chat section, I would request if you have any questions or patients, and even if we are not able to take all the questions in the live session today, you can leave an email address and we will, there is someone noting down the question, we will get back to you. Moving ahead, now we have a chat with Preeti Singh. She's among us. She's an author based in Chandigarh. She's published 3 novels and currently, are we able to see the slide, Mansi? So she's published a beautiful book on epilepsy. So her last novel is called Of Epilepsy, Butterflies, which
can you show the slide?
Mansi, are you around? Okay. All right.
Hello.
So can you see the slide now? Yeah. So she's a multifaceted personality. You can see the cover of the book which she's written, and she'll tell us more about it. And she's also a women's rights activist. She's been a single mother and a mother of a budding doctor. Then she's written this book, and also she helps working with people with epilepsy and to bring them out of the shadows and helping them to be productive. So welcome, Preeti Singh, to our event.
Thank you, Dr. Kharbanda. Thank you so much. And I'm so honored to be part of this webinar. I think I'm the only patient here, so I'm very, very nervous among all the doctors.
You'll be all right.
And in fact, my daughter is also one budding doctor in GMCH. So, and here I'm among so many such senior doctors. I think I've been so educated hearing all of you. And I've been sitting quietly like a patient. But all of you have been listening to all of you and getting so many tips. Thank you so much. Thank you so much, Indian Epilepsy Association, to get me here. I feel really, really humbled.
So today we want talking patients. These days, that's all communication. So many experts have said we don't want patients who just sit and listen. We want people like you who can be eloquent, who can come back and ask us questions. So that is a good thing. We have people like you working for these patients. So tell us briefly about your journey, Preeti, that from a person early in the age living with epilepsy to being a single mother and then to be a published author. Tell us a little more about your journey.
Sir, I developed epilepsy when I was 2 years of age. Apparently, I was dropped as a baby and there was some injury in the brain. And my father was from the army, and we were taught, like one of the panelists said, that medication doesn't have to be missed at all. So my father said, we travel from place to place, bilkul medication miss nahi karni hai. Whether you don't have any water, he was from the army, bag uthao or travel karo. Bilkul medication miss nahi karni, take medication, apne thuk se bhi lena hai, to medication leni hai. So I used to just have, as a child, I was taught that medication you have to take. So I grew up like that. There was drowsiness in school, there was lethargy in school, but I never really understood epilepsy as a child. And that's but natural. But as I grew up and my marriage didn't work out, that's okay. But you don't wallow in self-pity. And then there was this always desire to write something, and I took my career towards writing, and I felt happiness towards when I wrote my 4th book, which is the epilepsy book.
That's the one we're talking about. Thank you, Preeti. So what gives you the courage to carry on despite all the challenges you've had?
So there's always a choice in life. Either I could sulk and think that, hi, mainu ki ho gaya, what have I got? I'm having so many medicines in a day. Or I could just set an example for my child that, no, I have to overcome this and be positive. And it's that I may have epilepsy, but epilepsy does not have me. I can be positive about it. So I took the positive choice, and I said, nay, I said, epilepsy is just a small, tiny part of me. I will not let it consume me. Epilepsy ko aap, I'm sure there are patients listening. Epilepsy ko aap, don't let it ruin you. Don't let it run your life. Don't let it rule you. So I just have kept a positive. I'm a diabetic. I'm a hypertension patient, and but I'm trying a lot of exercise and everything, trying to reverse my diabetes. Baki rab rakha hai.
Thank you. Yeah. So tell us about this of Epilepsy Butterfly book. What is it about, and who's the target readers in this?
So I've did some research, and I've gathered about there are 8 epilepsy warriors from different fields of life. There's in fact, there's Kavita Shanbag ma'am from Samman Association, and Carol ma'am knows her. And there's an army officer. They are from different fields of life, 8 epilepsy warriors in this book who've told their stories. And they are very inspirational stories, how they suddenly got epilepsy, but they are like, they've overcome it and they're still struggling. And the last chapter holds how, for the layman, if anybody who is a non-epileptic but is a caregiver who is can simply they find somebody having a seizure on the road, they can give the first aid tips. And so the book is basically in very simple language, and anybody who knows, who 10th pass or 12th pass can read it. And the book now, I'm getting it translated in Hindi for a wider audience.
That's good.
For
Where
a
is it
wider
available?
audience.
If somebody needs a copy,
So
where
it's
can-
on Amazon, Flipkart, and if anybody wants, they can inbox me. I'll courier them
Thanks.
signed copies.
Thank you, Preeti. So the last thing is that it's a topic very close to your heart is when we chatted was that about the stigma associated with epilepsy and how people should, that's the name of your book also, of epilepsy,
Yes,
butterflies
sir.
flying beyond stigmas. So what do you
Yes,
think
sir.
what we can all do as a society, community to take the stigma away and let these people have more, or let everyone have a good productive life?
Like Dr. Sanjay very rightly said, it all starts from the family. Like most important point, like he said, हमको family से ही सिखाना है, बच्चों को भी सिखाना है, that घर से सिखाना है that ये कोई मिर्गी, it's not मतलब it's not a myth, माता नहीं आती है. I mean, I would like to say, inculcate from the children, from the school, from the education system, that there is nothing wrong. I think that, like, we used to have a moral science chapter, epilepsy should be started from schools itself. One point is that. Secondly, I think the young generation is so much into Bollywood, so much into YouTube. Hollywood has accepted epilepsy. So many big stars have epilepsy. Why hasn't our Bollywood accepted it? Why isn't there a movie made about it? Why haven't the stars accepted it? I'm sure there's some Bollywood stars have it, but they're not coming out in the open.
True.
So, I mean, I would love to somebody coming out in the open and telling about it.
True,
so there has to be complete revolution, and I hope somebody can do it.
Great. We all need to work together. Absolutely. There have been people have made movies in the epilepsy community, but no one has, you're talking about mainstream movies not accepting it. Yeah, let's hope it happens someday. But I think your story is such an inspiration to everyone who meets you, maybe reads your book, and now today listen to you. And it's so nice to have you had on this platform. Thank you, Preeti.
Thank you, sir. Thank you so much.
Dr. Param, one is time is running out. Mr. Pava has a comment to make. Can you ask him?
Sure, Mr. Pava, please.
I just want to say from our company or from our trust, we would like to sponsor medicines within Punjab. Anybody, your panel of doctors or the doctors recommends that he is a poor patient, he needs epilepsy medicine, so we'll sponsor it for his entire treatment, maybe 3 years or 5 years.
That is such a nice gesture, sir. I mean, I think that will go a long way in helping these patients. We do have many patients who have difficulty in affording. Thank you so much for saying that on this forum.
Thank you, sir. Thank you so much.
I think we had planned to finish by 6:15, 6:20. We are near the end. Yeah, Gagan, you wanted to say something?
No, I just wanted to say you've done a wonderful job and covered two very important aspects of epilepsy. One is for medication adherence, and the other thing is about Preeti. I'm completely floored. I think the first person who will buy your book today is myself. And there will be lot in the audience, and we'll be much more wiser. So
it's a wonderful book. I've read it. It's very well written.
So there are a lot of questions from the audience, and we have actually replied them most of the questions. But there are 2 to 3 pertinent questions. You can allow only 2 questions.
If there's something not discussed, you can say the questions. We can finish them in the next 5 minutes. Yeah.
So can a patient with epilepsy can use a device such as mobile phone?
Okay, can the patient with epilepsy use mobile phone devices or screens and something? So does anyone want to answer that among people who haven't spoken? Do we have Mamta here, Bindu here, Sita, Dr. Prabhakar, who haven't said anything? Any of you want to say? Yeah.
Dr. Meshram, would you like to answer that?
He may not be connected.
हाँ,
Right.
वो
Yeah.
लोग बोलते हैं कि मोबाइल यूज कर सकते हैं क्या? मोबाइल यूज कर सकते हैं, but don't overuse it. Any device is, you use it for whatever you want. यानी जितना जरूरी है उतना यूज करो, overuse मत करो.
True. So that is what we see. There are some people who have sensitive to flickering lights. So जिनको उस टाइप की एपिलेप्सी है, your doctor will tell you उसमें ज्यादा contrast, hyper contrast और patterns जैसे कोई flashing lights वगैरह उससे थोड़ा इफेक्ट पड़ सकता है. But without too much contrast in a well lit room, screen usage is okay for most of the patients. Obviously, as Dr. Meshram said, the overuse is bad. But you may have some type of epilepsy where you may need be a little careful. वो आप अपने डॉक्टर से जाके बात कर सकते हैं. Small types of, small section of epilepsies where flashing lights may be an issue. Vinit?
Sir, there are a lot of questions about pregnancy and epilepsy. That's 4 or 5 questions.
There is a separate session on pregnancy and epilepsy, so they can be covered there. And I think
the third thing is
first aid is also someone is asked.
Yes.
Yeah, we will have a separate session on COVID and epilepsy. So,
So only thing to emphasize is people are asking us, you should not miss medicines, even on the day of COVID vaccination. So 2 to 3 people have asked this question. You should not miss medicine. This already has been emphasized.
Yes, it's already been said. That's right, Vinit. Yeah. So not be missing medication on that. So
that's right.
So we will need a question in people who've left their emails. We will get back to you, and maybe otherwise we can take up Gagan these pertinent questions if there are any in one of the next meetings. There's going to be a regular meeting. Dr. Gagandeep is going to tell us all about it.
Yeah, so the next meeting would be, thank you, Dr. Param, and thank you all the panelists, some of the most senior people and most experienced people in the field of epilepsy and neurology have been here. Thank you all, the President, ma'am, Dr. Vengamma, all the past presidents, Professor Bendirata, who's been past president of the Indian Epilepsy Association, and the current president of the Indian Epilepsy Society, all the panelists, Preeti Singh, and all the attendees. I'm extremely, extremely grateful for sparing this time. And I think I am certainly wiser, and I'm sure most of us are go back wiser after this particular 1 hour session. I just want to inform, Mansi, can you show the final slide, please? Mansi, are you there? Please show us the final slide.
Yes, I'm just
as she
putting that
puts
up.
up that slide, can you, so our next session would be organized by the Mumbai chapter. It will be on the 3rd Sunday of September, 18th September, 5 to 6. So the topic is going to be disclosed very soon. And so again, a big huge thank you for everyone who attended and everyone who contributed to this session, everyone who contributed to the planning of this webinar series, particularly all the governing council members of the Indian Epilepsy Association.